Hello, Mrs. Weber. As we previously discussed, I have developed an exercise plan for you, and this is a startup plan, and we can make adjustments as we go along. I also want you to be aware that your physical exam was found to be normal, and you're ready to begin with your goal to add more physical exercise into your daily routine. On the first day of the plan, I would like for you to do a few things so we can establish some baseline measurements. First, I would like for you to record your weight and then also record the circumference of your waist. And then I would like for you to walk for 30 minutes and record how far you traveled during those 30 minutes. This will provide a comparison as you progress through the program and through the various weeks to show any kind of improvement or whether we need to modify. Once you begin the exercises, if you find that you're unable to complete the number of repetitions that I have listed, just do as many as you can and track those numbers as well. If you are able to complete all of those repetitions during the first week, I would like for you to add 3 to 5 exercises or repetitions to each exercise. And then the second week, go ahead and keep adding and continue to do so at your comfort. Now, every Saturday is a rest day, so I would like for you to rest and not do anything out of the normal. On Sundays, I would like for you to again walk for 30 minutes and record that distance, as well as weigh yourself again, record that number, and record the number of the circumference of your waist. Again, this is just for record keeping from week to week so we can track your progress and modify the plan accordingly. I've developed this plan for you based on recommendations from the CDC and some other resources. According to the CDC, adults should engage in 150 minutes of moderate to intense exercise per week. I think this is a good starting point for you, and we can progress to 300 minutes for greater benefits, again based on the CDC guidelines. Now, there are many benefits to your health by adding exercise into your daily life. For example, the risk of developing coronary or heart disease, diabetes, high blood pressure, having a stroke, or developing high blood pressure is reduced when you add exercise into your daily living and you keep active. Aerobic exercise is very important, especially for the heart, because it helps to strengthen it. And as you know, the heart is the most important muscle in our bodies. I'm glad that you have chosen to start exercising. But did you know that in the US, the leading cause of death for Latinos is coronary heart disease? I was pretty shocked to learn this, and being that we're both Hispanic, that's something that we need to take into consideration. Also, something else that I found interesting was that the World Health Organization has listed lack of physical activity as the 4th leading risk factor for global mortality. The higher the income for the country, then they had a higher prevalence. The lower the income in the countries, it is believed that they had a lower prevalence, but that's believed due to the lower income countries having to do more work just in general. Now, I know some of this information may be shocking or intimidating, but I wanted you to be well informed and to emphasize the important role exercise plays in our overall health. Now, we've talked about some of the benefits of exercise, but it's mostly aerobic exercise that I've talked about. But did you know that there are also benefits to strength training? For example, it can help reduce falls, it can help improve bone health, and help alleviate some symptoms of arthritis. I've incorporated strength training into your daily and weekly routines, so those are also in there from the CDC guidelines. Now let's go back to your workout plan. I've included a daily warm-up that will get your body going. It will raise your pulse and help prepare your muscles and joints for the exercises. After completing the workout, you're also going to do a cool down. That's the 5-minute walk after you're done completing the exercises. You may also add some stretches in the warm-up and or in the cool down phases of the workouts. You will experience soreness. That's always a definite. And you'll probably have that for 24 to 48 hours afterwards. And there are ways that you can help alleviate some of that soreness. Make sure you keep hydrated with water. Taking warm baths, or if you have a hot tub, that would also help relax those muscles. You can also put some ice because that will help reduce the inflammation. All those things will help with the soreness. The main thing is not to quit. If you're too tired or too sore, you can do a shorter workout. You may also substitute with other activities such as swimming, bicycling, taking brisk walks, maybe a light jog. You can take classes like Zumba, CrossFit, some dance classes, or yoga. This this is the important thing is to add this and to not quit. This is something that needs to be added to your daily lifestyle and implemented as a routine. There'll be days when you're really tired or you just may be running out of time, but even just 10 minutes of exercise will make a difference. If you experience any kind of sensation of pain or pressure in your chest in the middle or towards the left, or if you become lightheaded or faint, please give me a call. And or if you faint and you feel like you need to go to the emergency room, do so. If the symptoms like chest pain and shortness of breath don't alleviate within a little bit of resting, go ahead and seek help at an emergency department. And if you have any questions or if you have any concerns about the program, please feel free to call me. This is something we can go over and modify and adapt to your lifestyle. It's something that we want to keep working on. We don't want to quit. So if it's too much, we can cut back. If it's not enough, then we can add. Okay? Have a good day and let me know if you have any questions.